Snoring isn't just annoying your spouse anymore. It's actively destroying brain cells while you sleep. Neuroscientists have discovered 9 warning signs that reveal brain damage happening right now. These clues appear years before serious memory problems develop. Most seniors dismiss these symptoms as normal aging. They're actually signals of preventable brain deterioration during sleep. Medical imaging shows shocking brain changes in people who snore regularly. The brain literally shrinks in specific regions, controlling memory and thinking. Oxygen deprivation from snoring causes this devastating damage nightly. Your brain suffocates repeatedly without you knowing it's happening. Each breathing interruption kills neurons that never regenerate. Tomorrow morning, you'll have fewer functioning brain cells than tonight. Research from major medical centers reveals something terrifying. People who snore lose brain volume twice as fast as non-snorers. The gray matter containing your memories physically disappears. White matter connecting brain regions becomes damaged and scarred. These changes appear on MRI scans years before symptoms. By age 70, heavy snorers show brain aging of 90-year-olds. The first alarming clue is waking up with headaches regularly. Morning headaches signal your brain lacked oxygen during sleep. Carbon dioxide built up in your bloodstream overnight. This toxic buildup causes blood vessels to swell painfully. Your brain spent hours struggling for adequate oxygen supply. These headaches aren't from sleeping wrong or needing coffee. The pain typically starts at the skull base. It spreads forward, creating pressure behind your eyes. These headaches feel different from tension or migraine headaches. They improve within 30 minutes of waking usually. This improvement happens as oxygen levels normalize gradually. But the brain damage from nighttime oxygen deprivation remains. Brain scans reveal chronic morning headaches correlate with hippocampal shrinkage. The hippocampus controls memory formation and retrieval. People with frequent morning headaches show accelerated memory decline. Their cognitive test scores drop faster than normal aging. The damage accumulates silently over months and years. By the time memory problems appear, significant harm has occurred. Studies tracking thousands of seniors confirm this connection. Those reporting weekly morning headaches develop memory problems sooner. Their risk of cognitive impairment increased by 60%. The headaches served as early warning years in advance, yet most people just took painkillers and ignored them. This missed opportunity for early intervention proves tragic. The second critical clue involves excessive daytime fatigue. Feeling exhausted despite 8 hours in bed isn't normal. Your brain never reached restorative deep sleep stages. Snoring fragments sleep into useless shallow segments. The brain cannot perform essential maintenance without deep sleep. Toxic proteins accumulate instead of being cleared away. This exhaustion feels different from normal tiredness. Coffee doesn't help, and neither do naps. Your energy crashes unpredictably throughout the day. Simple tasks feel overwhelming and mentally draining. Reading becomes difficult because focus requires enormous effort. Social activities lose appeal due to constant fatigue. These proteins include beta-amyloid and tau tangles. Both substances are hallmarks of serious cognitive decline. Sleep laboratories document that heavy snorers accumulate these proteins faster. Their brains age 20 years faster than non-snorers. Daytime exhaustion signals this accelerated aging process. Your brain struggles to function with accumulated cellular debris. Research shows snorers have higher rates of depression and anxiety. Their brains cannot properly regulate serotonin and dopamine. These crucial neurotransmitters control mood and motivation. Without quality sleep, their production and reception become impaired. Family members often notice personality changes before cognitive symptoms appear. Increased irritability signals brain chemistry disruption from poor sleep. Antidepressants often get prescribed for these symptoms, but they don't address the underlying sleep problem. The depression returns when medication stops. Treating snoring resolves mood issues naturally. Many people discontinue antidepressants after addressing sleep apnea. Their brain chemistry normalizes with proper rest. The sixth critical clue is forgetting common words during speech. Searching for familiar words that won't come isn't normal. Your temporal lobes store and retrieve language information. Snoring reduces blood flow to these crucial regions. Oxygen-starved neurons cannot access stored vocabulary efficiently. Word-finding difficulties indicate temporal lobe damage accumulating. You know exactly what you want to say. The word exists right there but remains inaccessible. Frustration builds as you gesture and describe instead. Eventually, someone supplies the obvious word you couldn't find. These episodes become more frequent and embarrassing. Social withdrawal often follows due to communication difficulties. Language problems progress from occasional to frequent over time. Names of familiar objects become temporarily inaccessible. Conversations become frustrating as words escape you. People often substitute thing or whatchamacallit increasingly. These substitutions mask growing word retrieval problems. Speech becomes simpler as vocabulary access declines. Writing suffers along with speaking abilities. Emails take longer to compose now. Spelling familiar words becomes surprisingly difficult. Grammar mistakes increase despite knowing better. Text messages get shorter and simpler. These changes reflect temporal lobe oxygen deprivation. The seventh warning involves balance problems and coordination issues. Stumbling or feeling unsteady isn't just about aging. The cerebellum coordinates movement and maintains balance. Snoring deprives this region of essential oxygen nightly. Damaged cerebellar neurons cannot process spatial information properly. Falls become more frequent and dangerous over time. You might notice grabbing walls or furniture when walking. Stepping off curbs feels uncertain and scary. Getting up from chairs requires planning and effort. Darkness makes walking extremely challenging now. These changes indicate cerebellar damage from snoring. Fear of falling limits activities and independence. The protein accumulation creates a vicious cycle. More proteins mean worse sleep quality. Worse sleep prevents protein clearance. The buildup accelerates exponentially over time. Eventually, the proteins cause permanent neuron death. This explains why snorers develop memory problems earlier. The third warning sign is needing frequent bathroom trips nightly. Waking multiple times to urinate isn't just about aging. Snoring triggers stress hormones that increase urine production. Your body mistakes oxygen deprivation for a life-threatening emergency. These false alarms activate fight-or-flight responses repeatedly. Stress hormones force kidneys to produce more urine unnecessarily. The medical term is nocturia, and it's not inevitable. Healthy seniors shouldn't wake more than once nightly. 2 or more bathroom trips indicate sleep disruption. The bladder isn't actually full, usually. Stress hormones create false urgency sensations. This disrupts sleep architecture even more severely. Each awakening prevents your brain from completing sleep cycles. Memory consolidation happens during uninterrupted sleep periods. Fragmented sleep means yesterday's experiences don't become permanent memories. Important information gets lost instead of stored properly. People reporting frequent nighttime urination show measurable memory deficits. Their ability to form new memories declines progressively. Sleep researchers discovered something shocking about these awakenings. Even if you fall asleep quickly again, damage occurs. The brain needs 90-minute cycles for proper processing. Interruptions reset these cycles completely. 4 hours of fragmented sleep provides less restoration than 2 hours uninterrupted. Quality matters more than quantity for brain health. The fourth clue appears as difficulty concentrating during conversations. Missing parts of discussions or losing track isn't normal aging. Your prefrontal cortex suffers from chronic oxygen deprivation. This brain region manages attention and executive function. Snoring starves it of oxygen hundreds of times nightly. Damaged neurons cannot maintain focus effectively anymore. You might notice needing subtitles for television shows. Background noise makes conversations impossible to follow. Phone calls become frustrating and confusing experiences. Group discussions feel overwhelming and exhausting. These aren't hearing problems, but processing difficulties. Your brain cannot filter and focus properly. Concentration problems worsen gradually as damage accumulates. Family members notice you asking for repetition frequently. Following movie plots becomes increasingly difficult over time. Reading comprehension declines because attention wavers constantly. These changes indicate frontal lobe deterioration from snoring. The damage is reversible if caught early enough. Neurological tests reveal measurable attention deficits in snorers. Their reaction time slows significantly over years. Multitasking becomes nearly impossible to manage. Driving becomes dangerous due to reduced attention span. Work performance declines noticeably if still employed. These changes happen so gradually that many don't notice. The fifth alarming sign involves mood changes and irritability. Becoming short-tempered or depressed isn't just personality change. Sleep disruption alters brain chemistry and emotional regulation. The amygdala, your brain's emotional center, becomes hyperactive. Chronic sleep fragmentation prevents emotional processing and reset. Stress responses become exaggerated and harder to control. Small frustrations trigger disproportionate anger now. Patience with grandchildren decreases noticeably. Crying occurs more easily and unpredictably. Anxiety about minor issues keeps you awake. These emotional changes strain family relationships significantly. Spouses report walking on eggshells constantly. Sleep studies show snorers have reduced cerebellar volume. This shrinkage correlates with increased fall risk. Hip fractures and head injuries become more likely. Recovery from injuries takes longer with ongoing sleep damage. Balance problems often precede other cognitive symptoms. Early intervention can prevent devastating falls later. Physical therapy helps but doesn't address the cause. Balance exercises provide temporary improvement only. The underlying brain damage continues nightly. Without treating snoring, fall risk keeps increasing. Many seniors enter nursing homes after preventable falls. Addressing sleep apnea could maintain independence longer. The eighth clue appears as increased forgetfulness about recent events. Forgetting yesterday's activities while remembering childhood isn't normal. Short-term memory formation requires adequate REM sleep. Snoring prevents proper REM sleep cycles from occurring. New memories cannot transfer to long-term storage. Yesterday becomes a blur while decades ago remains clear. You might forget entire conversations from yesterday. Doctor appointments slip your mind completely. Medications get skipped or doubled accidentally. Important family events become confused or forgotten. These aren't senior moments but brain damage symptoms. The hippocampus cannot function without proper sleep. Brain imaging reveals snorers have smaller memory centers. The hippocampus shrinks faster than normal aging explains. Memory tests show deficits in recent event recall. These individuals remember distant past but not last week. Family gatherings become confusing without recent memory formation. Important appointments and medications get forgotten regularly. Family members become concerned and frustrated equally. They repeat information multiple times daily. Written notes become necessary for everything. Calendars and reminders fill the house. Independence decreases as memory problems worsen. Many families mistake this for dementia onset. The ninth and most serious sign involves microsleeps during daytime. Briefly dozing off while sitting isn't harmless tiredness. Your brain forcibly shuts down from severe sleep deprivation. These microsleeps last seconds but indicate critical exhaustion. Driving becomes extremely dangerous with involuntary sleep episodes. Many seniors don't realize they're having microsleeps. Television shows have gaps you don't remember. Conversations suddenly jump to different topics. Reading requires rereading the same paragraph repeatedly. These aren't attention problems but actual sleep episodes. Your brain cannot maintain consciousness anymore. Witnesses describe blank stares lasting several seconds. Witnesses report seeing blank stares or head nodding. The person denies falling asleep when questioned. Brain waves during microsleeps match deep sleep patterns. These episodes increase accident risk dramatically. Microsleeps indicate severe sleep disruption requiring immediate attention. Your brain literally cannot stay conscious anymore. Driving with microsleeps equals driving intoxicated. Reaction times disappear during these episodes. Many accidents occur with no braking attempts. The driver has no memory of the crash. These tragedies are completely preventable. Treating snoring eliminates microsleep episodes. Understanding these 9 clues demands immediate action for protection. Snoring isn't a harmless annoyance to tolerate. It's actively destroying irreplaceable brain tissue nightly. Every night of snoring ages your brain prematurely. The damage accumulates whether you notice or not. But there's hope if you act now. The first step requires honest sleep evaluation immediately. Ask your spouse about snoring frequency and volume. Record yourself sleeping with smartphone apps. Listen for gasping, choking, or silence between snores. These pauses indicate dangerous apnea episodes occurring. Document how many clues you're experiencing currently. Don't minimize or dismiss what you discover. Many seniors deny snoring despite evidence. Pride prevents them from seeking help. This denial costs precious brain cells nightly. Your cognitive future matters more than embarrassment. Face the truth about your sleep quality. Visit your doctor with this information compiled. Request a formal sleep study referral urgently. Modern home sleep tests are convenient and accurate. Insurance typically covers these diagnostic evaluations completely. Don't let embarrassment prevent proper medical assessment. Your brain's future depends on accurate diagnosis. Prepare for your appointment with specific examples. Write down all 9 clues you've noticed. Include frequency and severity of each symptom. Bring your spouse for additional observations. Doctors need complete information for proper diagnosis. Don't minimize symptoms during the consultation. Sleep position changes provide immediate improvement for many. Sleeping on your back worsens snoring significantly. The tongue falls backward, blocking airways partially. Side sleeping keeps airways more open naturally. Special pillows or tennis balls prevent back rolling. Elevating the bedhead reduces airway obstruction. Purchase a wedge pillow or adjustable bed frame. Elevation between 4 and 6 inches works best. This angle prevents tongue collapse effectively. Acid reflux also improves with elevation. Many people stop snoring with position changes alone. These solutions cost little but help significantly. Weight loss dramatically improves snoring and apnea. Even 10 pounds makes measurable differences. Neck fat compresses airways during sleep. Losing weight removes this physical obstruction. Diet changes benefit brain health beyond snoring. Mediterranean diets protect cognitive function particularly well. Start with small, sustainable changes gradually. Reduce portions rather than eliminating foods. Add walking or swimming for exercise. Weight loss improves sleep and cognition both. Energy levels increase as pounds decrease. Many eliminate snoring through weight loss alone. Avoid alcohol within 4 hours of bedtime. Alcohol relaxes throat muscles excessively. This relaxation worsens airway collapse during sleep. Sedatives and muscle relaxants have similar effects. Review all medications with your doctor. Some prescriptions worsen snoring as side effects. Consider dental devices for mild snoring cases. Custom mouthguards position jaws forward slightly. This positioning opens airways without machines. Dentists specializing in sleep disorders provide these. They're comfortable and travel easily. Many insurance plans cover therapeutic oral appliances. CPAP machines transform severe cases dramatically. Continuous positive airway pressure prevents airway collapse. Modern machines are quiet and comfortable. Masks come in many styles for preference. Most people adapt within 2 weeks. Brain function improves noticeably with consistent use. Don't give up if the first mask doesn't work. Try different styles until comfortable. Nasal pillows work for some people. Full face masks suit others better. Persistence pays off with dramatic improvements. Your brain deserves the effort required. Track improvements after starting treatment carefully. Morning headaches should disappear within weeks. Energy levels increase as sleep quality improves. Concentration and mood stabilize with better rest. Memory formation strengthens with proper sleep cycles. Family members notice positive personality changes. Your brain deserves oxygen-rich, restorative sleep nightly. These 9 clues warn of ongoing damage. Ignoring them guarantees accelerated cognitive decline. Taking action now protects your mental future. Quality sleep is medicine for your brain. The choice is clear and urgent today. Continue snoring and accept brain deterioration. Or address the problem and preserve cognition. Your future memories depend on tonight's decisions. Don't let another night damage your brain. Start protecting your cognitive health immediately. Type checking if you recognize these warning signs. Share which clues you're experiencing below. Your comments help others recognize their symptoms. Together we can preserve our generation's brain health. Every senior deserves quality sleep and clear thinking.